Hello, my name is Dr. Matute, UAPTC, University of Arkansas, Pulaski Tech. This is a brief summary of the blood vessels. Blood vessels are tubular structures that carry blood throughout tissues and organs. Blood vessels are tubular structures, they carry blood throughout tissues and organs. Composition. So, what are blood vessels made up of? Collagen and elastic fibers, connective tissue, smooth muscle cells, and endothelial cells. Composition of blood vessels: endothelial cells, smooth muscle cells, connective tissues, collagen, and elastic fibers. Why do we need blood vessels in the human body? It will avoid random spillage of blood. It brings about targeted distribution or supply of blood. It brings about orderliness in blood flow. So, necessity for blood vessels: orderliness of blood flow, targeted distribution and supply, and avoid random spillage of blood in the body. Types of blood vessels and their functions. Number one, arteries. They transport oxygen-rich blood away from the heart to all of the tissues of the body. Arterioles. They are small arteries. They deliver blood to the capillaries. Capillaries. They are thin-walled vessels. They are used for gaseous exchange between blood and tissue cells. They are also used for the exchange of other substances between cells and between blood and tissue cells. Veins. They return oxygen-poor blood to the heart. Venules. They are small veins. They collect and drain blood into the veins. One more time, types of blood vessels and their functions. Arteries. They transport oxygen-rich blood. Arterioles. They are small arteries. They deliver blood to the capillaries. Capillaries. These are sites for gaseous exchange and other exchange of substances between the blood and tissue cells. Veins. They transport oxygen-poor blood to the heart. So they return oxygen-poor blood to the heart. Venules. They are small veins. They collect and drain blood into the veins. Now, generally, arteries, they transport oxygen-rich blood, and veins, they transport oxygen-poor blood. However, there are exceptions. Pulmonary veins. Pulmonary veins. They transport oxygen-rich blood. Pulmonary arteries. They transport oxygen-poor blood. So if you put pulmonary in front of a vein or an artery, it does the opposite job. And every time you hear pulmonary, Pulmonary, every time you hear pulmonary, it means it is associated with the lungs. Now let's look at blood vessel anatomy. The walls of blood vessels, they have three layers. The walls of blood vessels, they have three layers. The outermost layer is the tunica externa or the adventitia. It is made up of collagen and elastin fibers. Collagen and elastin fibers. Its function is to protect, to attach or to anchor, and to reinforce the blood vessels. It also provides shock absorption. Tunica externa, outer layer, composed of collagen and elastin fibers. Its functions are protection, anchorage, reinforcement, and support via shock absorption. The middle layer is called the tunica media. It is made up of essentially smooth muscles. It also has elastic and collagen fibers. Its function is vasodilation and vasoconstriction. In other words, it can increase or decrease the diameter of the blood vessel. When the diameter of the blood vessel increases, more blood is transported. When the diameter of the blood vessel is decreased, less blood is transported. Vasoconstriction is a reduction of the diameter of the blood vessel, while vasodilation is an increase in the diameter of the blood vessels. The tunica intima, that's the third layer, it is made up of endothelial cells, endothelium, and its function is to reduce friction between the blood and the vessel. When blood is flowing, it makes contact with the containing vessel, and there's a friction. That friction can slow down blood flow. So the tunica intima is there to reduce that frictional force so as to allow for easy flow of blood. Now let's quickly see if we can look at do a quick comparison between veins and arteries, So generally, veins, they transport oxygen poor blood, and arteries, they transport oxygen-rich blood. This is a small table here that kind of summarizes some of the differences between veins and arteries. I hope you can see this, some of the differences between veins and arteries. So we have, in terms of the wall thickness, veins have thin walls, arteries have thick walls. Veins have a larger lumen, arteries have a smaller lumen. Veins have valves, arteries do not. Veins are more abundant than arteries. Veins have a surface location. Arteries are deep-seated. So when you look at somebody's arm and you are able to see blood vessels, it is very likely that what you are seeing are veins because they are found on the surface. Veins are bluish, arteries are reddish or pinkish. Veins transport oxygen poor blood. Veins transport oxygen poor blood. Arteries transport oxygen rich blood. Because veins are larger and arteries are smaller. Because veins are larger and arteries are smaller, and because veins are more numerous than arteries, more blood is found in veins than we find in arteries. So about 65% of our blood is found in veins and the remainder is found in arteries. Now let's go ahead and look at a few some major blood vessels that we have in the human body. We'll start with the great vessels. Great vessels. In a previous lecture, we had explained why they are called great vessels. So this is more like we are revisiting those vessels. But let's go through them real quick. We have the aorta. The aorta is the conduit, is the main conduit of oxygen rich blood from the heart to the rest of the body. Now, we have the aortic arch where the aorta curves, the aortic arch, the the sub vessels that originate or that are derived from the aortic arch, they take oxygen rich blood to the head, they take oxygen rich blood to the upper extremities, and they are also very important in blood pressure homeostasis. The vessels that are found at the arch of the aorta, they take blood, oxygen rich blood to the head, they take oxygen rich blood to the upper extremities, and they are also very important in the homeostasis of blood pressure in the human body. The descending aorta carries blood to the thorax, the abdomen, and lower limbs. This descending aorta, it carries oxygen-rich blood to the thorax, the abdomen, and the lower limbs. Next is the vena cava. There are two of them. Superior vena cava. It is valveless. It is a valveless vein. It transports and collects oxygen-poor blood from the upper half of the body and returns that to the right atrium. The inferior vena cava. It transports oxygen-poor blood from the abdomen and lower extremities back to the right atrium for oxygenation. The pulmonaries. We have the pulmonary trunk, which is also called the pulmonary arteries. It transports oxygen poor blood to the lungs. Pulmonary veins. They collect oxygen-rich blood and transport it from the lungs back to the heart. Pulmonary veins. They collect oxygen-rich blood from the lungs and they transport that blood back to the heart. Now let's go to the our lower limbs. Remember, our lower limbs are from our waist downwards. From our waist downwards, those are our lower limbs, which are the major blood vessels that transport blood to these areas and take oxygen poor blood away from these areas. So we have the common iliac arteries. The common iliac arteries. There are two of them. The external iliac artery and the internal iliac artery. They supply oxygen-rich blood to the lower limbs. Then we have the common iliac vein, subdivided into the external iliac vein and the internal iliac vein. They collect oxygen-poor blood from the lower limbs to return it back to the venous circulation. Next, we look at the thorax and the upper limbs. The thorax and the upper limbs. The subclavian artery supplies oxygen-rich blood to these regions. We are talking about the thorax and the upper limbs. The subclavian artery supplies oxygen-rich blood to this region, and the subclavian vein drains these regions of oxygen-poor blood. So it drains or it collects oxygen-poor blood from this region to return it to the venous circulation. Neck and head. the neck and head regions, they are supplied with oxygen-rich blood by the common carotid artery. Common carotid artery. The neck and the head, they are drained of oxygen-poor blood by the jugular vein. Jugular vein. Now let's go to the kidneys. The kidneys have the renal arteries and the renal vein. Renal artery takes oxygen-rich blood to the kidney. Renal vein, it takes away oxygen-poor blood from the kidney. Then for the stomach, we have the gastric artery and the gastric vein. For the liver, we have the hepatic arteries and then we have the hepatic portal vein. Remember, veins, they take away oxygen-poor blood, which is carbon dioxide-rich blood, away from organs to return it back to the general venous circulation. Then for the heart, we have the cardiac vein and the coronary artery. Cardiac vein and coronary artery. The brain, the human brain. There are two arteries that supply blood to the human brain. We have the internal carotid arteries and the vertebral arteries. Vertebral arteries and internal carotid arteries. The jugular vein drains oxygen-poor blood from the brain, the jugular vein. Let's look at the lungs. For the lungs, we have the pulmonary arteries and pulmonary veins. Pulmonary veins, they supply oxygen-rich blood to the lungs, while pulmonary arteries, they take away oxygen-poor blood from the lungs. Now let's look at the circulatory routes or the circulatory systems in the human body. The first one is the pulmonary circulation. Pulmonary circulation. Every time you hear pulmonary, it has to do with the lungs. And any blood that is going to the lungs is oxygen-poor blood. So the pulmonary circulation, it transports oxygen-poor blood from the right ventricle to the lungs for gaseous exchange or for oxygenation. Systemic circulation or the systemic circuit, it provides the functional blood supply to all tissues of the body. In other words, it transports oxygen-rich blood to all tissues of the body. Now, oxygen and nutrients are transported to the cells, to the respective cells via the systemic circuit. And this circuit, it also picks up carbon dioxide and waste products. The systemic circuit, it carries oxygen-rich blood from the left ventricle through the arteries to the tissues of the body. The systemic circuit, it carries oxygen-rich blood from the left ventricle through the arteries to all of the tissues of the body. Now, the pulmonary circuit and systemic circuit that are controlled by the heart do not serve the heart. They do not serve the heart. So the heart has its own blood circulatory route or system. It's called the coronary circulation. Coronary circulation. It supplies the heart muscles, so the heart is essentially a muscle, and it carries oxygen. The coronary artery supplies oxygen-rich blood to the heart muscles, while the cardiac veins, they drain the heart of oxygen-poor blood, and they return this oxygen-poor blood to the right atrium. So the coronary artery supplies the heart with oxygen-rich blood, while the cardiac vein, it drains the heart of oxygen-poor blood and returns this blood to the right atrium. Now let's say something quickly about coronary bypass surgery. Sometimes the coronary arteries of the heart may be blocked, and when they are blocked, they are not able to supply enough oxygen-rich blood to the heart muscles. Heart cells must have oxygen-rich blood at all times. So if this happens persistently, what will happen is the patient is going to have what we call a coronary bypass surgery. How does that work? They will simply take some tubes and they redirect or they tap blood from the aorta back to the heart. From the aorta back to the heart. So if a particular coronary artery is blocked and is unable to supply blood, then they'll take some small tubes, they connect it to the aorta that contains oxygen-rich blood, and then they'll tap some of that blood back from the aorta, and then they'll attach it to that blocked artery so that it will be supplied blood from the aorta, and that blood now will start circulating into the heart. That will prevent the heart cells from dying. So if you had two of those tubes from the aorta back to the heart, then that will be called a double bypass. If you have three of those tubes, then that will be called a triple bypass. The number of tubes that you have that taps or redirects blood from the aorta back to the heart depends on how serious the condition is. Now let's quickly say something a little bit in details about the systemic circulation. So systemic circulation, essentially you have blood leaves the heart, it goes to the body, and then it goes to the lungs. Specifically for systemic circulation, you have oxygen-rich blood will leave the lungs, it will be transported to the left atrium. From the left atrium, it will be transported to the left ventricle. From the left ventricle, it will be transported to the aorta. And from the aorta, it will be transported to the rest of the body. So one more time, the systemic circuit is oxygen-rich blood from the lungs to the LA, from the LA to the LV, from the LV to the aorta, and from the aorta to the body, general circulation. How about the pulmonary circuit? The pulmonary circuit. So the pulmonary circuit, it starts from the superior and inferior vena cava, from the superior and inferior vena cava. So blood from the inferior vena cava and the superior vena cava enters the heart via the right atrium, RA. From the right atrium, it will be transported to the RV, right ventricle. From the right ventricle, it will be pumped to the lungs for gaseous exchange. Gaseous exchange means that the carbon dioxide will be exchanged for oxygen. Let's say something about blood pressure. Blood pressure. Blood pressure is a measure of resistance to blood flow. Blood pressure, resistance, a measure of resistance to blood flow. And blood pressure is normally measured in the units of measurement are millimeters mercury. Millimeters mercury. There are three sources of resistance to blood flow. Three sources to resistance to blood flow. Number one, blood viscosity, which means blood thickness. Number two, the length of the blood vessels. The length of the blood vessels. Number three, the diameter of the blood vessels. Now let's talk about blood viscosity. If your blood is thick, then the flow of blood becomes slow. When your blood flow is slow, then it means that the tissues and the cells do not get the amount of energy that they need because they're not getting the blood that has the oxygen. Then what your heart will do is your heart will start pumping faster and harder, faster and harder. As your heart pumps faster and harder, your blood pressure rises. Number two is the length of the blood vessels. People who are tall, very tall, they are more prone to having blood pressure problems as opposed to people who are shorter. That's because if you're the very tall people, they have longer blood vessels. So the heart has to pump harder to ensure that blood gets to all parts of the body. As the heart pumps harder, so increases your blood pressure. Then blood pressure diameter. If the diameter of your blood pressure or if the diameter of your blood vessels are small, which means that they transport less blood, your heart will have to be pumping faster and harder to make sure that all parts of the body they get the amount of blood that they need to have at any unit given time. So smaller blood vessels diameter means the heart will be pumping harder and faster. That increases the blood pressure. If your blood pressure diameters, if the diameters of your blood vessels are large, blood will flow without much problems, so the heart will not have to pump any extra harder and any extra faster for blood to be able to flow. That way your blood pressure remains normal. Good. So what is normal blood pressure? Normal blood pressure is about say 120 millimeters mercury over 80 millimeters mercury. So there are two values. There's an upper value and there's a lower value. In other words, there's a numerator and there is a denominator. The upper value is the systolic pressure. So the 120 is the systolic pressure. Systolic pressure is when the heart contracts. When the heart contracts, the SLV valves, the semi-lunar valves, they will open and blood will flow out. When your heart contracts, the SLV valves will open and the blood will flow out of the heart. That is what constitutes systolic pressure, the 120. Then once as blood has been pumped out of the heart, your heart relaxes. When your heart is relaxing, the SLV valves, they will close. The SLV valve, that is semi-lunar valves, will close when your heart is relaxing. That also generates pressure. That pressure is called, that's what is called the diastolic pressure. So diastolic pressure is when the heart is relaxing and the SLV valve they close. That's what gives us the 80 millimeters mercury. Now the pulse pressure is normally the difference between systolic pressure and diastolic pressure. So it normally, because since our systolic pressure is not always higher, so we subtract diastolic pressure from systolic pressure and it gives us the pulse pressure. Then MAP. MAP is mean arterial pressure. So the pressure that is found in arteries, mean arterial pressure. The highest pressure is found in the aorta. And then as the aorta goes all over the body, it keeps up subdividing into smaller arteries until it gets to your fingers and to your toes. The mean arterial pressure is to measure the pressure of blood all along the arterial system. And how is that calculated? It is the diastolic pressure plus the pulse pressure divided by 3. So MAP is calculated as diastolic pressure plus pulse pressure divided by 3. Now, why is MAP important? MAP propels blood into tissues. MAP, it propels blood into tissues. And MAP is kind of tied with tissue perfusion. MAP is tied with tissue perfusion. So MAP and tissue perfusion, they have 5 main functions in the human body. You have this in your notes. Number 1, they deliver oxygen and nutrients to tissues. Number 2, they remove carbon dioxide and waste from tissues. Number 3, gas exchange in lungs. Number 3, nutrient absorption from the gut. And number 5, urine formation in kidneys. Circulatory shock. Circulatory shock is when blood volume is inadequate, when blood does not circulate normally, when blood flow does not meet tissue needs. Remember, for women have 4 to 5 liters of blood. Normally, men 5 to 6 liters of blood. So if a woman has less than 4 liters of blood, the woman can go into circulatory shock. If a man has less than 5, so if a woman has less than 4 liters of blood, she can go into a circulatory shock. If a man has less than 5 liters of blood at any point in time, he may go into a circulatory shock. Now, if you go back and look at the study material that are provided, you are given 4 examples there of circulatory shock. Please read them. We have the hypovolemic shock, vascular shock, transient vascular shock, and cardiogenic shock. Now, blood pressure functions. The blood pressure has at least 3 functions in the human body. It moves blood around the body through the circulatory system. We're looking at functions of blood pressure. It moves blood around the body. And this blood that contains oxygen and nutrients is channeled to tissues and organs. Number 3, the blood pressure transports immune cells to all parts of the body. These immune cells, which are white blood cells, they protect us from diseases and infections. Homeostatic imbalances. Homeostatic imbalances. Again, you have this in your notes. There are 3 homeostatic imbalances. I think you have it in your notes as aging aspects of the cardiovascular system. So we have the congenital vascular problems, that's one. We have arteriosclerosis, that's another one. And then number 3, we have blood pressure. Congenital vascular problems, these are problems that we are born with. These are problems we are born with. They only manifest themselves in older age. When you get old, that's when they start manifesting themselves. Now they include muscle cramping, tingling of the fingers and the toes, and and varicose veins. Varicose veins. Varicose veins means twisted, enlarged veins. Twisted, enlarged veins. The second homeostatic imbalance is atherosclerosis. Atherosclerosis. It is the build-up of fats, cholesterol, and other substances inside the walls of arterial vessels, arteries. When this happens, the blood vessel becomes thick and the diameter decreases. The blood vessel becomes thick and the diameter decreases. And when this happens, that blood vessel transports less blood. The third one is blood pressure. Blood pressure. Um, Infants have a different standard, a different norm or normal for blood pressure. Youths, they have theirs, and then older folks, they have theirs. So for infants, a normal blood pressure will be considered to be 90/55. For youths, 120/80, and for older adults, 150/90.